The opioid epidemic continues to impact thousands in Orange County, but there is a life-saving tool available for overdose victims. Ronique Bain, community health epidemiologist for the Florida Department of Health in Orange County, joins us to discuss opioid overdoses and the Naloxone nasal spray, which can reverse the effects. So this is going to be an interesting one. Welcome, Ronique.
Thank you.
First, let's start off by defining what an epidemiologist does.
So an epidemiologist's basic role is the study of infectious diseases. They also have different facets of data analysis and research. So we're there pretty much the undercover people to investigate diseases and help find the cause and root of it.
The why behind
Yes.
what the rest of us are seeing.
Mm-hmm.
The opioid epidemic, we've heard stories. Why is this so serious?
It's serious because it affects thousands, hundreds of thousands of individuals who experience pain, and they're prescribed certain drugs that would help to lessen their pain level, but it also comes with a double-edged sword, as in with it lessening the pain level, it also can form a level of addiction too as well.
So there's two sides to that coin.
Yes.
And are these drugs very easy to get addicted to?
Yes, because it's blocking the pain tolerance. So once you've met that threshold, you want more and more.
You want to maintain it.
And you want to maintain, yes.
So tell us why naloxone is so important. It's also called Narcan.
Yes.
Why is that such an important weapon in this fight?
So naloxone is a medication, also known as Narcan, that rapidly reverses the effects of an opioid overdose. It attaches to the opioid receptors by reversing and blocking the effects of the drug.
Let's talk about the effects of the drug first to kind of help us understand why Narcan is so important. What are the danger signs that someone is overdosing or is at risk for an overdose?
So the signs that we look out for, and anyone should look out for to identify if someone is experiencing an overdose, is that they have a change in their skin color. It could look cloudy or clammy. Also, their lips, discoloration of their lips and their nails. If they're appearing to look limp or losing consciousness or just not having
Kind of
steady
like
speech.
they're fading away?
Yes.
Okay. Then what should you do when you see signs like that?
So when you see signs like that, the goal would be to have a Narcan kit with you. And how you would administer Narcan is first you would make sure the individual is on their back, tilt their chin backwards, insert the nozzle into their nostril, press down on the plunger to release the dose. And once the dose is released, that's it. There's no additional dose in that unit. So it's important not to try to test it before using it. And immediately after administering the dose, you want to call 911. And sometimes persons do wake up, and that is the hope that they do. If you have to administer it 2 to 3 times after, you want to switch nostrils so that, the dose effectively goes where it needs to go.
And it works that quickly?
Yes, it can.
So that's the beauty of this.
Yes.
Where do people get it, and how much does it cost?
So it's free, and you can receive
Free?
it. Yes, free of cost.
How do you get it?
So you can receive it at our Florida Department of Health in Orange County, 2 campuses. So you have the Southside Health Clinic, which is west of Orange Blossom Trail, right off of Oak Ridge. And also you have our Southside Clinic, which is downtown. You can go to building 1 or 2 and just go to the receptionist desk and ask for Narcan or Naloxone.
And you can find information online,
Yes.
and you also have a phone number.
Yes, so the information and resources online can be found at iflsave.com, and also you can contact us at 407-723-5004.
Can you give that number one more time?
Yes, that's 407-723-5004.
As an epidemiologist, and you do this all the time, how excited are you about this, or do you think it's just a drop in the bucket?
Well,
have you seen it, the results?
We have seen the results in the community, especially when doing outreaches. People do come up to our tables and ask if we have it. We usually have it on site, and where they can find it. So we're seeing that people are engaging and wanting to know where it is, and there's also other community resources that do supply Narcan too as well, just to get the word out there so people are aware it does exist.
And there's a no questions asked, there's no background checks if you
Nothing.
ask for it. You're just about saving lives.
Yes.
Well, thank you for taking us inside that advance and helping people live through what is obviously a crisis that's not going to go away anytime soon.
Yes.
Thank you. Opioid overdoses can happen to anyone, whether accidental or otherwise, through prescriptions or through other opioids. You have the power to save lives. If you know someone at risk for opioid overdose, carry Narcan and learn to administer it safely. If you'd like more information about Narcan, call the Violence and Injury Prevention Program at the Florida Department of Health in Orange County at 407-723-5004. To learn more, visit orange.floridahealth.gov.